Hello, good evening everyone. My name is Kristel C. Saldua, BEd 1D. Our topic for today is all about the symptoms of pregnancy. What is pregnancy? Pregnancy occurs when the sperm fertilizes an egg after it released from the ovary during evaluation. The fertilized egg then travels down into the uterus where the implantation occurs. A successful implantation results in the pregnancy. On average, a full-term pregnancy lasts 40 weeks. There are many factors that can affect a pregnancy. Women who receive an early pregnancy diagnosis and prenatal care are more likely to experience a healthy pregnancy and give birth to a healthy baby. Knowing what to expect during the full pregnancy terms is important for monitoring both of your health and the health of the baby. If you like to prevent pregnancy, there are also effective forms of birth control you should keep in your mind. Symptoms of pregnancy. You may notice some signs and symptoms before you even take a pregnancy test. Others will be appear weeks later as your hormone levels change. A missed period. A missed period is the one of the earliest symptoms of pregnancy and may be the most classic one. However, a missed period doesn't necessarily mean you are pregnant, especially if your cycle tends to be irregular. There are many health conditions other than pregnancy that can cause a late or missed period. Headache. Headaches are common in early pregnancy. They are usually caused by altered hormone levels and increased blood volume. Contact your doctor if your headaches don't go away or are especially painful. Spotting. Some women may experience light bleeding and spotting in early pregnancy. There bleeding is the most often the result of the implantation. Implantation usually occurs 1 to 2 weeks after fertilization. Early pregnancy. Bleeding can also result from relatively minor conditions such as infection or irritation. The latter often affects the surface of the cervix, which is the sensitive during pregnancy. Bleeding can also sometimes signals a serious pregnancy complication, such as miscarriage, ectopic pregnancy, or placenta previa. Always contact your doctor if you're concerned. Weight gain. Can you expect to gain between 1 and 4 pounds in your first few months of pregnancy? Weight gain becomes more noticeable toward the beginning of your second trimester. Pregnancy-induced hypertension, high blood pressure, or hypertension sometimes develop during pregnancy. A number of factors increase your risk, including being overweight or obese, smoking, having a prior history or a family history of pregnancy-induced hypertension, heartburn. Hormones released during pregnancy can sometimes relax the valve between your stomach and your esophagus. When stomach acid leaks out, this can result in heartburn, constipation, hormone changes during early pregnancy can slow down your digestive system. As a result, you can may constipated, cramps, as the muscles in your uterus begin to stretch and expand. You may feel a pulling sensation that resembles menstrual cramps. If your spotting or bleeding occurs alongside your cramps, it could signal a miscarriage or a ectopic pregnancy. Back pain. Hormones and the stress on the muscle are the biggest causes of the back pain in the early pregnancy. Later on, your increased weight and shifted center of the gravity may add your back pain. Around half of the pregnancy, women report back pain during their pregnancy. Anemia. Anemia women have an increased risk of the one which causes symptoms such as lightheaded, dizziness, and the condition can lead of the premature birth and low birth weight. Prenatal care usually involves screening for anemia. Depression. Between 14 and 23% of the all pregnant women develop depression during their pregnancy. There are many biological and emotional changes you experience can be contributing causes. Be sure to tell your doctor if you don't feel like your usual self. Insomnia. Insomnia is the other common symptoms of early pregnancy. Stress, physical discomfort, and hormonal changes can be contributing causes. A balanced diet, good sleep habits, and yoga stretches can also help good night's sleep. Breast breast changes are the one of the first noticeable signs of the pregnancy, even before you far even along for a positive test. Your breast may begin to feel tender, swollen, and generally heavy or full. Your nipples may also become larger and the more sensitive, and aerosol may darken. Acne. Because of your increased androgen hormones, many women experience some in early pregnancy. Their hormones can make your skin oilier, which can clog pores. Pregnancy. Acne is usually temporary and clear after the baby is born. Vomiting. Vomiting is the component of morning sickness, a common symptom that usually appear when the first or 4 months morning. Sickness is often the first sign that you are pregnant. Increased hormones during early pregnancy are the main cause. Hip pain. Hip pain is a common during pregnancy. The tense of the increase in the late pregnancy. It can have variety of the causes, including pressure on your ligaments, sciatica, changes in your posture, a heavy uterus, diarrhea. Diarrhea and the other digestive difficulties occurs frequently during pregnancy. Hormone changes, a different diet, and the added stress are all possible explanation if your diarrhea lasts more than a few days. Contact your doctor if you don't become dehydrated. Stress and the pregnancy. While pregnancy is usually a happy time, it can also be source of stress. A new baby begins changes to your body, your personal relationship, and even your fiancés. Don't hesitate to ask your doctor for help if you begin to feel overwhelmed. If you think you may be pregnant, you should rely solely on these signs and symptoms. For confirmation, taking a home pregnancy test or seeing your doctor if your lab testing can confirm a possible pregnancy. Many of these signs and symptoms can also be caused by other health conditions, such as pregnancy menstrual syndrome (PMS). Learn more about the early pregnancy of symptoms pregnancy, such as how soon they'll appear after you miss your period. Pregnancy symptoms. 10 early pregnancy that you may be pregnant. Pregnancy week by the week. Pregnancy weeks are grouped into 3 trimesters, each one with the medical milestone for both you and the baby. First trimester, as the baby grows rapidly during the first trimester. First 1 to 2. The fetus begin developing their brain, spinal cord, and the organs. The baby's heart will also begin to beat during the first trimester. The probability of the miscarriage is relatively high, according to American College of Obstetrician and the Gynecologist (ACOG). It's estimated that about 1 to 10 pregnancies end in the miscarriage, and about 85% of this occurs in the first trimester. Seek immediately help if you experience the symptoms of the miscarriage. Second trimester. During the second trimester of the pregnancy, 13 weeks to 27 weeks, your healthcare provider will likely to perform an anatomy scan, ultrasound. This test checks the fetus babies for any developmental abnormalities. The test result can also reveal the sex of your baby. If you wish to find out before the baby born, you'll be probably begin to feel your baby move, kick, and punch inside your uterus. After 20 weeks, a baby and the uterus is considered viable. That's all for today. Once again, thank you for watching.